Okay, my name is Ceja, and I am a graduate from the year of 2005 of Napa Valley College Associate Degree Nursing Program. I'm a registered nurse now, and I work at Queen of the Valley Hospital in labor and delivery, which is my dream job. I have 4 children. I am married and currently have been married for 20 years. When I started the program, I had, well, let's see, that would have been 4 years ago. So I have 18-year-old twins, so they would have been 14 at the time. My son would have been 9. And interestingly enough, my very first day of nursing school was my baby's first day of kindergarten. So that was a very difficult thing for me. As a family, you're working towards a positive common goal of, hey, okay, mom's in school right now, we all got to pull together. And my older girls were just a huge, huge help to me during that time. They pulled their weight with doing chores and helped with the younger kids, and really I think that taught them a huge sense of responsibility and also a good work ethic for mom's trying to do something positive, so hey, let's get in there and help her, and let's all do this together as a family. And I know my husband had that attitude too. We were all working together for something really important. Basically, my biggest tip for organizational things with children was that Sunday evening was kind of sacred. Once I started the nursing program, Sunday evening had to be my drop dead, let's get everything done time. I would set out 5 outfits for my children for the week, and that was, my 2 older ones were kind of on their own, but my 2 younger ones, I pretty much had to do everything for them. I would either iron or organize an outfit for each day of the week, 5 days of the week, hang them up on a hanger, including socks and sweaters, whatever needed to go with it, and that was hanging in their closet so that they had 5 outfits ready to go. We did not have to even discuss that before school or before I left to for clinicals or whatever in the morning. I just knew that they had their clothing organized. Lunches were made the night before. My lunch was made the night before. Those were very, very important things that minimized our morning routine, helped things go a little smoother in the morning. The kids, I had 2 uniforms for clinicals so that I would always be sure that one was clean. Everything was washed on Sunday night. That was sort of my Sunday night. If we did things on the weekend, my husband just knew Sunday evening was my time for getting organized. One thing that's really important, that was an important thing for myself, was I think that each person who's starting the nursing program needs to understand what is the best time for study for your own body's rhythm. I am a morning person, even though I work night shift. I function best in the morning. I absorb and retain best in the morning. So if you're a night person, then maybe pulling an all-nighter works for you, but that didn't work for me. So I would set my alarm at 4:30, 5 o'clock in the morning, and that was my study time, my quiet study time. And you do need to have that with children. It's just, you do have to have that uninterrupted study time. I carried my books with me in my car, and I made flashcards, and I carried my flashcards in my purse, and my kids had various practices, softball, basketball, baseball, and I would carry those flashcards with me everywhere I went, and my notes and my books. We would sometimes go away on family trips, and I'd have my books with me, and pretty much, every chance I got, I was studying. As far as positive things that the nursing program gave to my kids, it gave them a sense of independence. They did have to be a little more independent. They did have to be self-sufficient. They did have to learn how to hurry up and be on time and be organized, and teach them a little bit of organizational skills too. So at this point you might be thinking I'm a really organized mom. So this is the sad story of my organizational skills. I had been a stay-at-home mom for several years, was working part-time for our family's business while I was doing my prereqs and getting ready to go into the program. And so getting ready for my little girl to start kindergarten was a big thing, and obviously she needed her checkup and her booster shots and all her paperwork done. Well, lo and behold, I forgot to get her immunization card updated and to turn in before the first day of school. So I was at my first day of nursing school, and my husband was taking her to her first day of kindergarten, and she did not have her shots. So didn't have the shot record. And so the kindergarten teacher told my husband that she wasn't going to be able to stay at school that day. So my husband was frantically calling me on my cell phone, and of course I had my cell phone off because I was in my first day of nursing classes. And when I went out on my break, got all my messages and basically had like a nervous breakdown. I started crying and didn't know where my daughter was, didn't know where my husband was, and really thought, gosh, I don't know if I can do this. I really was really disappointed in myself because I thought I was such an organized mom and didn't do the shot record. So that was a really difficult time. So after that first day, when I was feeling like I wasn't going to be able to go on because I was feeling a horrible mother because I didn't get that immunization card in time to the school, it all worked out just fine. My husband, I talked to him on the phone. I said, the immunization card's in the drawer. He got it. He took Gabby back to class, and she finished out the day, and everything was fine. During my break, I was in tears. And that was when I made those connections with those women that I ended up being in the study group with. And every one of them, with their support, their loving support, said to me, you are not a bad mom. If you were a bad mom, you wouldn't be here right now, because what you're doing is for your family and for your kids. So I think that the positive support that I had from those friends was a big, huge turning point for me in saying, they're right, I am a good mom, I'm not a bad mom. We supported each other in every single way. We emotionally, psychologically, spiritually, in every way. We talked and talked and talked, and that was just, I think one of the keys to my success in nursing school was just having that other person that knew what I was going through. You can go home and tell your family all you want about a horrible test or an awful day that you had in clinical, but if they weren't there to see it, then there's just something about that person who's there experiencing it with you that can give you that support. There's just nothing like it. In my last semester of nursing school, there was a Mother's Day lunch, I think, or tea or something at my daughter's school. And of course, it was the day that I was in clinical, and it was the very end of nursing school, and there was no way that I could miss that day and be able to make it up and graduate, or I had an exam or something. And I was on the phone with my sister, and I was in tears, and I said, I don't know what I'm going to do. And she said, you know what, I'll go. And so anyway, my sister went, and she filled in for me as my daughter's mom that day. And just, my daughter was so happy to have Auntie Les there. It was awesome. And it was just things like that you come against an obstacle. You might come up against an obstacle and think, I can't do this. I cannot do this. And then you talk it out with somebody in your family, in your study group, one of your friends, and there's always a solution, and there's always a way that you can work it out so that you can be a wonderful mom and a wonderful nursing student and turn into a wonderful nurse. And every test that I took, every step of the way, my family was cheering me on, and this is where I'll get emotional. Every test that I took, everything that I did, they were right there asking me, Mom, did you get a good grade? Mom, what did you get? And when I get an A on a test, it was just, everybody was cheering, and it was just awesome. It was just a really great thing. So, and to this day, my husband uses this whole experience in our life as an example for our kids and says, look at what your mom did. Look at what your mom did. And I think really motherhood prepares us for being nurses, because I think mothers make great nurses. We are excellent at multitasking. We can listen to 1,000 requests at one time and get a lot of stuff done in a short amount of time without losing our temper.